Now, till now we have the basic ideas like what is cancer, okay, what are the types of cancer, what it disturbs in our body. But till now we didn't understood that which cells are involved, what happening at a cellular and molecular level in our cells, that our cells, a healthy cells, a beautiful cells, a precious cells is in turn into the cancerous states. So see, normally in our body there is a structure and functional relationship. Now what I mean by the structure and the function relationship, the structure and function relationship is that the structures which is you can say designed of our organs, of our cell, it is closely related with the functions, their functions. Okay, you ever think that why stomach is like bag like a structure? Okay, suppose if it's a rectangular structure, is there any way to, you can say there's a proper peristalsis movement? No, just because of their anatomical structures, okay, their function is going smoothly. Their function is going smoothly. And this also explained that why not all the human cell function is present in the other creatures, okay, other you can say the animals. Certain animals, they eat the raw meat, okay, and they digest that very well. But if we eat the raw milk, it's very difficult to digest. Why? Because their anatomical structure of the organ is different, okay, and also there is a different histology of their stomach. Fine. But for in our case, there is a one specific arrangement of the cells which necessitate the specific function. So whenever cancer appear, it also first it's destroy this structure and function relationship, because you know that in the cancer there is a changes in the shape, there is a changes in the anatomy of the cell. So it's clear that if the anatomy of the cell will change, it means the function will change. Fine. Another property is called as the contact inhibition. Now this contact inhibition is one of the fundamental property of our cell, which by which one cell regulate the growth of another cell. Okay, this is called as the contact inhibition. Fine. So when cancer appear, it also take away this function, the contact inhibition. Now another thing is the metamorphosis. Generally our body cells grow in a sequence. Okay, it's grow in a sequence. It is characterized by sometimes the geometric progression, okay, sometimes it is you can say described by the arithmetic progression. But whenever cancer appear, you cannot predict that in how much time it can goes into the thousands of the cell. You cannot predict. Okay, so there is a large transformation, and that large transformation is called as the metamorphosis. Fine. Apart from these broader, you can say, changes, there is a certain subtle changes, the minute changes, and that is about the genetic mutation. Okay, mutation means you can say changes in our genetic machinery, changes in the DNA. Okay, that's called the mutation. Another one is the activation of oncogene. We have the various types of cell in our body, and one of the type is called as the proto-oncogene. Okay, these proto-oncogenes are one special type of cell which control the abnormal, you can say the abnormal growth, and which can regulate the cells to not become the cancerous. Okay, so whenever if there is any disturbance in their function, this proto-oncogene change into the oncogenes. Okay, and this oncogenes is a, you can say, cancer causing cell. Then we also have the tumor suppressor genes. Okay, tumor suppressor genes which suppress you can say the hypertrophy growth of the cell. So cancer also lost this tumor suppressor gene. And another one is the immune invasion. Immune invasion means when the cancer cells successfully you can say invade the immune system. That's called the immune invasion, when our immune system loses the fight with the cancer cell, and that is called immune evasion. Then we have another as well, you can say the controlling of one cell to other cell, and that is called about the signaling pathway. Okay, signaling pathway. So there is also a loss of signaling pathway. Got it? No problem. Okay, let's move to the next slide. See the liver cancer. We've seen the different terminologies about the liver cancer, but generally the liver cancers are divided into the two parts, or you can say the two classification. The one is called as the HCC, okay, hepatic cellular carcinoma, okay, hepatocellular cellular carcinoma. Another one is called as the intrahepatic cholangiocarcinoma. We've seen hepatocyte, we also seen the cholangiocytes. Cholangiocytes are basically the bile duct cell, okay, and the hepatocytes are the liver cell. So remember, whenever cancer appear in the liver become, you can say, enlarged, or there is a increase in the weight of liver, okay. And this HCC, also called as hepatocellular carcinoma, and this is you can say that there is a large incident. 70 to 85% cases are from the HCC, and the ICC is a rare. It's about 10 to 20%. Now, apart from this, there are other types of liver cancer called as the hemangiocarcinoma, angiocarcinoma, fibrolaminar carcinoma, and hepatoblastoma. Angiosarcoma means when there is an abnormal growth of blood vessels in the liver, that's called the angiosarcoma, okay, hemangiosarcoma. And there is a fibrous growth. Sometimes the liver fibrosis may in turn into the liver cancer. Fine. Let's see another slide about the etiology and the pathophysiology. Generally, the etiology goes with certain infections, okay, certain infections like the viral hepatitis is one of the most causative agent of the cancer. Fine. And then the liver cirrhosis, and you know the liver cirrhosis, there are types, but the main causes is till now you can say described is about is with the alcohols, okay, alcohols. Fine. Alcohol consumptions. So the first is the chronic viral hepatitis, another one is the cirrhosis, alcohol abuse, and the non-alcoholic fatty liver diseases called as NAFLD. When there is a disruption in the metabolism of the fats, okay, that result into the NAFLD, also called as the non-alcoholic fatty liver diseases. So healthy cell, they change into the hepatocellular carcinoma, which result into the cirrhosis, and sometimes this cirrhosis you can say is due to the chronic hepatitis. Now, what are the clinical presentation? You know that pain will come, okay. First, the pain will come. Generally, whenever the cancer appear, it's started with the painless property, okay. It's a silent disease. Cancer is also called as the silent disease. So initially, in the initial period of the cancer growth, there is no pain, but in the, you can say, if there is a proper growth of the cancer cell, then there is a pain in the upper right abdominal part, okay, upper right abdominal part. And you know that generally the biliary, you can say the bile metabolism, okay, the bilirubin, biliverdin, this is done through the liver. This is done through the liver. So whenever cancer appear, there is a chances for developing the jaundice, okay. Then there is the unexplained weight loss. Liver is mainly, as I said, that is mainly involved in the metabolism, okay. Mainly it's involved in the metabolism. You know, all those biochemical cycles like glycolysis, you can say genolysis, glyconeogenesis, this is all done by the help of liver. This is all done in the liver, the lipolysis, okay, lipogenesis. So whenever cancer appear, there is unexplained weight loss in reference of the liver cancer. Now, then we have the fatigue, loss of appetite, okay, nausea and vomiting. When it's trigger the nausea center in our brain, result into the vomiting and the nausea. And the MRI and CT scan explain the enlarged liver condition, okay. Then there is accumulation of fluid in the abdominal, you can say peritoneal cavity, called as the ascites. And there are other symptoms of the advanced diseases. Okay, there are certain advanced features, means you can say the secondary growth, okay, or you can say secondary carcinoma, secondary liver carcinoma, means and now the cancer is not localized only up to the liver. Now it's start spreading. To the other parts, and wherever they goes, they you can say impose certain sign and symptom, and that is called as the symptom of advanced disease, symptoms of advanced liver cancer. Fine, got it? Clear with this slide? Okay, now let's move to the next slide. Now come to the management. What are the ways to manage this cancer? You've seen that cancer is about the abnormal cell growth. So the one way to prevent, okay, to you can say minimize the cancer is to disrupt their abnormal growth. Okay, they disrupt their abnormal growth. So this is done through the inhibition of cell division. Okay, and that is done by one category of one classes of drug, and that is called as the paclitaxel. Paclitaxel. Got it? Yeah, I have problem with the pronunciation, so it's good to cooperate with me and suggest me. You can comment down. I will try to work upon it. I will try to improve it. Fine. Now, the another way to prevent the cancer is to make them die. You have to make them in you can say such a state where they are no longer able to grow. Okay, they are no longer able to grow, and you know, like this property is generally happening in our body cells. Okay, so whenever any cell deviate from their normal function, okay, other cells direct those abnormally grown cell, you can go to this state. Okay, and this is called as the, this is a programming. This is also called as the programmed cell death. Okay, and there's one beautiful term which is used in reference of the programmed cell death, and that is called as the apoptosis. So you can induce the apoptosis, okay, by certain drugs, and one drug is called as the doxorubicin. Then you can say you can boost your immune cell. Yeah, that's a one way to prevent the cancer, to you can say lose the fight of cancer, is to modulate your immune system. You can strengthen your immune system by certain immune modulators, and one of the immune modulator is the pembrolizumab. Okay, and these are certain examples, but there are lots of cancer disease. Okay, there are lots of cancer disease called as the anti-cancer drugs, and in broader way they are also called as the chemotherapy. Okay, chemotherapy. Then you can also disrupt the abnormal you can say blood vessel growth, that is called angiogenesis. So one of the feature of the, you can say the one of the histopathological feature of a cancer is there is a, you can say, growth of abnormal blood vessels. Cancer cell need less nutrient, but they need a steady supply of the nutrients, and this is done through making the new blood vessel. Okay, so there is a angiogenesis. So you can also disrupt the supply of the nutrient to the cancer cell by disrupting this phenomenon called as the angiogenesis. Okay, and this is done through one drug called as avastin. Fine. Apart from that, you can spread the secondary growth of the cell, that is called as the metastasis. So you can stop the metastasis through one drug called as the etoposide. So etoposide, avastin, doxorubicin, these are certain common chemotherapeutic drugs. Fine. So this is about managing through the chemical compounds, okay, through the drugs. Now let's see, is there any other ways to prevent the cancer? Of course, there are ways, and that is called as the radiation therapy. So radiation therapy is one common treatment in the cancer, okay, by which we are generally emitting the certain radiation, okay, certain radiation, and these radiations, whenever they goes to the cancer cells, they mutate their genetic machinery, and thereby there is a suppression of the growth of cancer cell, okay, preventing them to divide and proliferate. But there are side effects. This is a very good way to manage the cancer, okay, but there are certain side effects like the called as alopecia, a hair loss, okay, and sometimes when there is no any specificity related with imposing the radiation, then radiation itself causes the cancer, okay. So remember that cancer is managed well by combining the different you can say treatment modalities, like you can simultaneously use the chemotherapy with the radiation therapy with certain another features like the certain surgeries. Fine. Now, so these are certain nursing management related with the liver cancer, okay, and that generally goes with providing the, you can say, best care with by the symptom management, by monitoring the vital sign, okay, by monitoring the vital sign, and there is a supportive care. Cancer patients need they need the emotional support, and that's why the duty of nurse is the empathic, providing the, you can say, the empathy to have the empathy toward the patient. And the nutritional support, nutrition also, you can say, it's also play a very pivotal role, and look, like in cancer you have to sometimes in certain cancers you have to avoid certain nutrients basically, and sometimes we have to add certain palatable nutrients, okay, certain palatable nutrients, and that is well take care about the nurses, okay. Then there's the palliative care, means the overall care you have to provide the, you can say, the physical support, the psychosocial support, okay, as well as you have to also, you can say, provide, you can say, the moral strength to the cancer patient, because the depression are closely linked with the chronic cancer patients, okay. And this palliative care is also about you can say providing the care to the terminally ill patients, when there is no any chances to make those patients in a recover state. On that very moment you have to provide all your best, okay. And then other thing is, another function of a nurse is to educate the patient, to educate the normal population as well. Fine. Is there any other treatment ways? Yeah, there are other treatment ways, and that's a modern treatment ways, okay. And that is done through the target therapies, okay, certain immune therapies, okay. And you know, in most of the cancer you can say studies is done through the mice. It is done through the mice in the laboratory, and there are biomarkers, okay. There are biomarkers, means, and those you can say chemical clues, which shows that patient have this kind of cancer or other kind of cancer. So this is called as the biomarker of the cancer, okay. So in nowadays there are specialized screening way to detect this biomarker as soon as possible and start the early treatment, so that we can make patient recover as soon as we can. Fine. And there are certain target therapies, there are one way called as the CRISPR, okay, means you cut it down the genetic material, okay, abnormally mutated you can say DNA sequence. Fine. And there are many evolving ways to treat the cancer, and the one of the way to treat the cancer, as I seen recently, and which also won the Nobel Prizes, is called as the bioorthogonal chemistry. In the bioorthogonal chemistry, you can change the sugar sequence, okay. called as the slic acid sequence of the cell membranes. Okay, and thereby you protect basically the cell. Okay, you protect the nearby cells which is present, you can say the periphery of a cancer cell. You can protect those cells. Okay, and thereby you can targetedly destroy the cancer cell. So these are the ways of the treatment. Fine. So for concluding today's lectures, we basically discussed about the cancer, and we've seen that the cancers are really a very pathetic situation for a human population. Okay, and it's challenging a lot. It's challenging nowadays a lot to the India, and there are treatment modalities, but prevention is always, remember, prevention is always better than the cure. So there are preventive measures. Okay, and that's all about today's class. So thank you for having me. Bye. Have a nice day.